said that we stand on the shoulders of those who have come before us. And before I was KAFP president, I was 6 feet 8 inches tall and good looking. Before I give my little thank you, I've got a clarification and an announcement to make. The clarification is Bob Wergen said yesterday that the AAFP Board of Directors agenda is 1,300 pages long for each meeting. And I just want you to know that's not true. It's only 100 pages long, but when we have a board member from Nebraska, we always use large print and lots of pictures. Bob's been one of my best friends for 20 years, so I can tell that. Now the announcement. You heard today at noon that Doug Woolley received the Exemplary Teacher Award in the full-time category for the state of Kansas. We just learned this afternoon that he's received the National Award. Stories about Doug. First of all, I'm going to tell you a couple stories. And Doug is an expert clinician. Several years ago, I had a patient in the nursing home who was losing weight and just not doing well. And this guy, he was frail and debilitated, and I was really, I had this ethical concern about should I put him through colonoscopy and EGD and CAT scans and a lot of stuff like that. So I went and talked to Doug, and Doug said, "Did you watch him eat?" I said, "Watch him eat? What's that got to do with it? I want to know, am I going to do a $1 billion workout?" And Doug said, "Go watch him eat." So I went and watched him eat. And the nurses would take him and put him in the long-term care center at his table. They'd feed him a couple bites, and that was it. And so once we talked to the nurses, they said, "You need to pay a little bit of attention to this guy." And they started feeding him and taking care of him. He gained his weight back, and he got better. That is an expert sign of a clinician. That's the Then another story of Doug's. I hadn't been here very long. No, another story on Doug. I moved from Salina to here. I hadn't been here very long, and Doug came into my office one day. He said, "Rick, we need to set up a standardized patient program." I said, "Well, what's that?" And he goes, "Well, it's where you have these people that are specially trained and the students and residents can practice." I said, "Doug, what do we need actors for? What do we need fake patients? I mean, we got Via Christi that's full of patients. We've got Wesley, it's full of patients. We've got docs throughout town. We got docs throughout rural communities, long-term care centers. What do we need these fake patients for?" And he said, "Rick, how do medical students learn to give bad news?" And I thought, you got a great point. Because we learn by trial and error. And we do a pretty lousy job of it until we get a little better at it. And so out of that, Doug wrote a large grant to the federal government, got it funded, got the standardized patient program started. And that's how that whole thing got started 15 years ago. So in Doug, you've got an expert clinician, an outstanding educator, and I'm just so pumped that we've got a national winner. We've had 11 national winners in the volunteer category. This is our first winner in the full-time category. So let's thank everybody. So now my thank you. I'm really a little embarrassed by this because I know you folks and you know me. And we've got great family docs. I'm going to take the award anyway. But so when you get this, Carolyn sends you an email and she says you do 4 things. Number 1, thank your nominators, thank your family, talk about your passion for family medicine, and sit down. So I want to thank my nominators. I'm not exactly sure who they all were because I haven't seen the letters, but I am pretty sure that Debbie Haynes, Scott Moser, John Dorsch, John Roselle, Gretchen Dixon, Rob Freelove, and Mark Stovak were the perpetrators of this. And so I really want to thank you for getting together and doing this. Second thing is to thank my family. So first I want to thank my mother, who is here. Phyllis Kellerman, stand up, Mom. What does she say this time?
She doesn't know you.
Yeah, that's true. She doesn't. My daughter, Katie. And then my two sons, John, just started a job at the Hutch News, so he didn't want to miss work or anything like that, because he wants this job. My other son, that's James at the Hutch News. John is in Southern California and just got a job with Paramount Pictures, and we're really proud of him. And then Janet couldn't be here tonight. The priest that married us is having his 50th anniversary of whatever priests have 50th anniversaries for. And so it's in New York, and she had this thing planned for like a year. And so she really had to go to that. And so I was putting her on the plane on Wednesday, and I said, Janet, in your wildest dreams, when we got married 33 years ago, did you ever think I would be the Kansas Family Physician of the Year? And she said, Rick, I love you, but I got to tell you, you're not in my wildest dreams. Remember, this is the same woman that several years ago I was getting packed, and I was putting all this stuff in the suitcase, and she said, Rick, where are you going? And I said, well, I'm going to this think tank. And she looked at me and scrunched up her nose and said, well, what did they invite you for? So I told her I was part of the control group. Janet and I met. She was a nurse on the newborn ICU unit when I was a resident, and I got to tell you, she looks great in scrubs. But she's sorry she didn't be here. So I'm not going to talk about my passion for family medicine. I'm actually going to tell a story about Doug and Shelley. When they were students here, they don't even know this story, but I remember. When they were students here, Shelley's from Stockton originally, and I delivered her cousin-in-law with a tornado on the ground about 5 miles away. And Doug and Shelley were medical students at the same time. So I was telling about some of my experiences in Plainville when I practiced there, where Jim Rule and Lynn Fisher practice, and Beth Loney and Mike Aller now practice in Stockton, along with Dan Sanchez in Plainville. I mean, you talk about a group of good family docs. So I was telling about my experiences and telling about patients in the office and in the emergency room and long-term care and in the hospital and just lots of dramatic stories. And I was showing my passion at that point. And but I thought about it when they were gone, and I thought, Rick, these stories were really all about me, things I enjoyed. I mean, seeing someone in the emergency room, car wrecks, all sorts of agriculture accidents, oil field accidents, and that sort of thing. But I started thinking, what's really the evidence behind what we do? Is there evidence behind the value of family medicine? So I looked it up. I did a literature search, and there really wasn't anything out there. So for our December meeting, we invited one of the top knowledgeable people in the United States, top leaders in family medicine, and I asked her to talk on the value of family medicine. And she came, she had an hour scheduled, she talked for about 20 minutes and said, there's really not a lot of evidence that what we do makes a difference for the population. Yeah, we have good stories, and I'll tell some stories about cancers we diagnosed early, and we'll tell stories about MIs we took care of in the emergency room, but there's just not a lot of evidence. So I was getting kind of discouraged, and I went to the AAP Congress of Delegates, and Doug Henley gave a talk. And Doug got up and said, what we need is research on the value of family medicine. And he said, and if we don't get that research, or if the research shows that we really don't make a difference in this healthcare system, we ought to admit it, pack it up, close up the specialty, and go home. Well, I was ticked, okay? I didn't know Doug Henley at that time, but I was ticked. I said, who is this guy? He was president of the academy. I said, how do we start impeachment ceremonies? How do we need to recall this guy. So now fast forward 15 years to where we are now. And we've got the evidence out there by Starfield, Winberg, Shee, Fisher, Baker, Chandra, international, national, state by state, and county by county evidence that what you do matters. In fact, we now know that if we have a healthcare system that has a robust group of family physicians at its base, there are better mortality rates, better morbidity rates, better care of preventive illness, better care of chronic care illness, better quality of care indicators, patients like it better, and it all costs less. And that's exactly what we don't have in this healthcare system, is a broad base of great family docs. They say we're undervalued, and we are, by the healthcare systems and by government. Let me tell you, you are not undervalued by your patients. So I just want you to know that that is the value of family medicine. And why is this? Well, I think it's due to those core concepts of family medicine. Comprehensive care, access to care, coordination of care, taking care of patients within the context of their family and their community. It's about the biopsychosocial approach that we take to patients. It's about the doctor-patient relationship. It's about all of those. There are 6 words that make a difference. The doctor will see you now. Those 6 words are a benediction of hope for those who are sick, for those who are depressed, for those who are discouraged, for those who need your help. So with that, I thank you for this award, and I'm going to go sit down.